Good evening, everyone. Thank you so much for coming out on this rainy evening. I was hoping that it didn't disrupt anyone from coming, and you guys are all here, so thank you so much for making it out. Today we want to share information about a wonderful new program on campus. It's a health professions advising office with a mission. And so before we get into sharing a little bit about our program and an amazing panel after my little presentation and giving you information, before we get started, I would like to know who's in the room. So if you guys don't mind, very quickly, just going around and letting me know what's your name, what's your major, and what health profession are you interested in. And if you don't know, it's totally fine to say you're exploring. So if you don't mind, Shada, do you want to start? Thank you.
Hi, everyone. My name is Shada. I'm a third-year exercise science major. I'm currently in the primary care and delivery pathway. And I think that's the one I'm going to kind of stick with if I continue on this program.
Thank you.
So, hi everyone, my name's Stephanie. I'm a bioscience major, also third year, and I'm interested in nursing.
Right, thank you.
I'm Jasmine. I'm a second year being pre-med major, and I'm interested in pediatrics.
Hi, I'm Bernice, and I'm majoring in biological science, minoring in psychological science, and I am interested in psychiatry.
I'm a first year biomedical engineering major, and I'm kind of wildly swinging between oncology and virology.
Thank you.
Hi, I'm Emily. I'm a third year DNE pre-med major. I'm looking into being for pediatrician or family medicine physician.
My name is Tina. I'm a farm science major, and I'm open to anything.
I'm Caesar. I'm a fourth year biosci major and I'm exploring.
My name is Amanda. I'm a second year bioscience student and I'm interested in endocrinology.
My name is Stacy, and I'm a second year biosci major, and I'm interested in the physician assistant field.
My name is Horacio. I'm a fourth year human bio major and I'm interested in cardiology/oncology.
Hi everyone, my name is William Hernandez. I'm a fourth year psychological science major. I'm in the behavioral health trackway and I'm interested in health research.
Hi, my name is Justin Urquiza. I'm a second year biosci major and I'm interested in pediatrics.
Hi, I'm a fourth year and I'm interested in public health.
Hi, my name is Natalie and I'm a third year psychology major and I'm still exploring, but I'm leaning towards nursing.
Hi, my name is Janelle. I'm a third year language science major and I'm interested in BA or physician.
Hi, my name is Jamie. I'm a third year BME major and I'm interested in cardiology.
Hi, my name is Gabriel. I'm a third year public health sciences major. I'm interested in medicine and infectious diseases research.
Hi, my name is Gabriela. I'm a fourth year bioscience Chicano studies double major. And I want to go into pediatrics or biomedical research.
Yeah. Hi, my name is Lucy. I'm a third major and I'm interested in pediatrics.
Hi, my name is Stephanie. I'm a second year nursing major and I'm interested in psychiatric nursing.
Hi, my name is Natalie. I'm a second year public health major and I'm interested in gynecology or just women's health.
Hi, my name is Kathleen. I'm a first year nursing major and I'm interested in emergency medicine.
Hi, my name is also Natalie and I'm first year. I'm still exploring.
My name is Avrina. I'm a third year bioscience major and I'm hoping to go to medical school.
Okay, well, thank you so much, everyone.
There's someone in the back there.
Say it again.
There's someone behind.
Did I miss somebody back there?
Hi everyone, my name is Juan, and I'm an applied physics major, second year, still exploring.
Thank you so much. So I asked that just so that you all can hear who's in the room. We have a diversity of majors, a diversity of healthcare interests. So I always like to remind students that pre-health is not just one area. Pre-health is a diverse career that you can go into. And definitely just understand that there's a lot of options out there for you. And that's one of our missions here at UC Prime Pre-Health Pathways, is to know that you have many options if you're interested in healthcare. So thank you so much for introducing yourselves. Next, we're going to introduce ourselves as the team of UC Prime Pre-Health Pathways. So first, I will introduce my coordinators. So Veronica.
Before I begin, there's a physical sign-in sheet going around. You don't have to sign it if you already checked in with the QR code. If you haven't signed with the QR code, then you can sign that paper. We're just making sure we get everyone. But yeah, so my name is Veronica Garcia. I'm the Outreach and Evaluation Coordinator. Actually graduated from UC Irvine in 2018. I studied psychology and criminology. I went off to work. Then I went back to school. So I recently got my master's in global health, where I was working with migrants, specifically their barriers to healthcare access. And so that kind of led me to joining UC3P because through my research, I learned that one of the major barriers for equitable healthcare is the lack of representation in hospitals and clinics. So I'm hoping that this program helps us increase the number of healthcare practitioners that look like the communities they're serving. Thank you all for being here, and it's nice to see some new faces.
And Josue?
Hi everyone, my name is Josue Ruedas, he, him, él. I'm the Career Pathways Coordinator for the program. Similar to Vero, I graduated from UCI not too long ago. So I'm back now, right? Really looking forward to empower you all to get to the careers that you are interested in, right? Because again, similar to Vero, it's a reality that our communities of color are often suffering or neglected because of systemic failures, right? So I'm hoping that our efforts here will lead to some radical changes that benefit our communities. So thank you for coming.
And last but not least, do you want to introduce yourself? Dr. Bilomek.
Yeah, hi, my name's John Bilomek. I use he, him pronouns. I go by Dr. B. I'm a faculty member in our School of Medicine in the Department of Family Medicine. I'm a health services researcher, and I mostly do work in our federally qualified health centers, which are kind of the clinics that really serve low-income communities. I took a very strange and nonlinear path to get into my career, and so I really love the focus of this Pathways program. It's not a pipeline that everyone follows the exact same route, and I really love when people find their strength, in different directions. If you're interested in careers in medicine, I'm also very available to meet with you. I have regular office hours every week you can book times with, and we'll make sure we share that booking link. But I direct the Helios Lab, which is undergraduate mentored research program in health equities. There's several Helios Lab members here, so welcome. Thanks for being here. And I'm just so excited to be one of the faculty leads supporting this brand new program here at UCI. So thanks for being here tonight.
Thank you so much. And as I mentioned, my name is Lena Njoku, and I too am a first generation college student. And my story is that I started out as pre-med, as many of you are. And throughout my education, I went to Cal Poly Pomona for undergrad. And throughout my educational journey, it was really those intense science courses that discouraged me from continuing to pursue a medical career. And as a first generation college student, when I got to that point of discouragement, rather than kind of seeking out additional resources to help me overcome those challenges that comes with the difficult coursework that pre-med or pre-health has, I decided to pivot my path. And so as I've gone through my path and kind of went on a journey of student affairs, because I wanted to help people, and I found that my strengths were in helping students that were like me and had the similar challenges that I did as a first generation college student. So here, we are all here today because as a department and as a program, our purpose is to build that equity within healthcare by removing barriers that first generation or marginalized students may have in pursuing healthcare careers. because we know healthcare careers in particular have those very difficult and intense classes and have many challenges that students do have to overcome. And if you are first generation or marginalized students, those challenges may be even bigger and those gaps may be even more as far as the knowledge base to get to your end goal. So this program is a program really to fill those gaps for marginalized first generation underrepresented students. And that's why we're here today. So as with this presentation, I would like to kind of share a little bit about the program history, a little bit about how you can get involved, how you can apply. And then after that, we're going to have a panel of a couple of current Prime scholars and what they've enjoyed about the program. And hopefully they can encourage you to apply and get involved in UC3P your time here at UC Irvine. Okay, so going into a little bit about what UC3P is, just a brief history of it. So how many of you have ever heard of Prime? Has anyone heard of Prime here? A couple of you? Okay, so Prime is a program that's at the medical school level. So Prime started in 2004 right here at UC Irvine at the School of Medicine for a mission to the mission that we just mentioned. So basically closing those equity gaps in healthcare. And they started that at the medical school level. And now we wanted to move it to the undergraduate level, closing those equity gaps, but not just in medicine, but health professions overall. So that's why the first thing that you guys come in and see is that list of a vast list of health professions that you can go into, because we want students to understand that you have options. It's not just one way to go. So that's a little bit about the start of Prime. So it started here at UCI Medical School in 2004. And then now in 2023, we now have a Prime Pre-Health Pathways, which is the undergraduate arm, helping underrepresented students get to many healthcare careers. So our particular mission is to support diverse undergraduates at UCI. And we want to encourage students to explore various health professions. And we want to support students that plan on being healthcare providers right here in California. Just a little bit about where we are, where we're located. So we are a program that was developed from two different programs. So between the School of Medicine and this Chicano Latino Studies Department within the School of Social Sciences. And what we are really encouraging students to understand is that you don't necessarily have to be, I know there's many bio-sci majors here, but you don't have to be a bio-sci major to pursue these health professions that we're going to discuss. So we're located in an area where we're not promoting that there's only one major to get to the health professions. So we are located in Social Science Tower, room 330 and 334, but we're still under construction. So we're building our space where you can come and get pre-health advising, have workshops and events, and we are developing our resource hub for everything you need to know about whatever health profession that you're interested in pursuing. So why should you join UC3P? I want to talk a little bit about what it means to be a health profession, what it means to be a competitive applicant, and then really what we do to help you fill those gaps and become a competitive applicant. So no matter whether you are pre-med, pre-pharm, pre-PA, pre-dental, pre-anything, typically these are the areas in which you should be a strong candidate when you get to that point of application. So these are very important areas. You should have healthcare related experience. How do you know you want to go into a certain field if you haven't gotten your feet wet? Typically, they want to see community service and leadership. Healthcare professionals are leaders in our communities. So you should show some type of leadership experience within your profile. Research, that's how medicine changes. That's how healthcare changes. That's how we make progress in our culture, in our communities, is through research. So that's something that we really promote and want you to understand that process and to get into a space or a lab where you can really exercise your research skills. Letters of evaluation are what others think of you. So that's your networking skills. Are you going to office hours? Are you developing relationships with people that are in healthcare professions that you're interested in going into? Your academic achievement is very important because you need to set that solid foundation here in your undergraduate career so that those health profession programs can see that you have the ability to face that coursework that is in that graduate level program. And then, of course, last but not least is the gap or growth year. So 10 years ago, everyone thought that a gap year or growth year was a negative aspect to your application, but today it's much different. When you hear gap year, you should hear growth year. You should hear exploration. You should hear self-development. You should hear professional development. You should hear more time to understand who you are as it relates to what you want to do. So we definitely encourage students to take that time before undergrad and after undergrad, but before you start your graduate school program. So these are all the areas in which you should be considering and working on to become a competitive applicant. So how does UC3P kind of help you in all of those areas to develop? So we provide a seminar series, so similar like you guys are here today. We provide pre-health advising, so really walking through with you each step of the way, no matter whether you're a first year or your last year, understanding what you should be doing at that point in your undergraduate career or your pre-health journey. We will be a resource hub, so we are all a part of a national organization that really stays up on what's new in the health profession. So we want to be able to give you all that information that is up to date. And then we have cohort support. So we'll talk a little bit about the cohorts that we have available and what that means. So there are 3 different cohort programs. Today, we're really going to focus on the Prime Scholars because that's who you all are, would be eligible to apply for. But we also do have Prime Mentors that serve as, and we do have one here today. And we'll speak with her in a moment. The Prime Mentors serve as mentors to our scholars, and those are graduate students. This year, we have 7 medical school students. And then in future years, we're hoping to have various graduate students serving as mentors. We also have Prime Fellows, which are post-undergraduates that are getting assistance and getting to their next level, but they are graduates of UCI. So those are the 3 cohort programs that we have. And let's talk specifically about the Prime Scholars because many of you are probably coming here because you're interested in that program. So the Prime Scholars, it's a 1-year commitment that we're asking from students, and it starts with an intensive summer program. So just a little bit about what this program provides. We do provide financial support. So at the start of that intensive summer program, we do provide a stipend for you to support you through that summer. There is mentorship, as I mentioned, from medical school graduate students or graduate students from various health professions in the future. Research opportunities. So this is a big part of our program that you are in an equity-focused research lab. Service learning, that's a very important aspect of going into the healthcare field in general. So we want we will place you and have opportunities for service learning activities. And then, of course, the supportive cohort. Being in a cohort with like-minded individuals, all focused on health equity, we have quite a good time already, as you will hear from the scholars during the panel. And I just wanted to share with you our faculty PIs that are mentoring our current scholars right now and share with you the various tracks that they are on. So we have the primary care delivery and health service track, and Dr. Bella McCure is one of our PIs in that area. We also have community-based initiatives in health equity, biomedical transitional research, behavioral health and psychology, health policy and public health. So this is what we have right now, but this is not the limit to what students can be involved in, but this is just a sample of the areas in which our students are currently doing research within health equity, but various areas in that space. Okay, so eligibility, what does it take to be a Prime Scholar? So number one, you do have to be available to attend a summer program, and it's a 6-week summer program during the first session of summer. We do want you to have a desire to pursue a career in health. So that can vary from many of those professions that are listed on the paper in front of you, but we do just want you to have an interest in going into some type of healthcare field. You should be graduating in 2025 or after. This is particularly to apply for the Prime Scholar program. We want you to have a commitment to health equity and an interest in research, because those are two big parts of our program. A little bit about the application timeline. So applications will open January 15th of 2024, so next year. We do have a priority deadline of February 16th. The new cohort will be announced March 25th, and then our new cohort orientation will be April 9th. And then the actual program, summer program, will start June 24th, which lines up with the first summer session. And let's talk about some expectations. So you've gone through the process. Once you've been accepted as a scholar, this is what we are requiring of you. We do want you to attend, as I mentioned, the summer. During the summer, you will be attending in-person sessions weekly. You will be doing supervised research with an approved PI, and then developing a research question to prepare for the Spring 25 UROP Symposium. During the academic year, we expect students to continue on that same intensive research from the summer into the school year. And it may not be as many hours, a little less hours per week, because you'll have a full school load, but we do want you to continue that. And a lot of students continue it via a 199 course. Present at UROP in the spring. And then, as I mentioned, continue your research via a 199 course or its equivalent. So next, I want to kind of talk about how you can take advantage of the resources through UC3P. No matter what year you are, we have a little something for everyone. So I just went through the Prime program, and for those of you who are in your third year now, that's applicable to you. But if you're in your first or your second year, we'll talk a little bit about what you should be doing and then how you can be involved with UC3P. So for your first year, those of you who are first year, we actually do have a winter Introduction to Health Professions freshman seminar. So we're really excited about that. And this seminar, we're going to really dive into various health professions and you finding your authentic health profession. So we definitely want you to come in with open minds, open hearts, and understanding that if you have a passion for health, we can kind of help refine what that particular career that works for you is going to. Also, within your first year, you can attend sessions like you are today. And really your first year, it should be establishing your academic foundation. So if you are in your first year, this is when you're really adjusting to school, adjusting to the university setting, and making sure that you're going to office hours, making sure that you're going to tutoring. You know, have you been to the LARC Center? If you haven't been to the LARC Center, I highly encourage you to make sure that you do if you're not getting tutoring in any other ways. This is a time to establish those academic habits to make sure that you're settling a good foundation academically so you can go forward and do well in those courses and be prepared for a competitive application. But then your second year, still attending the UC3P events, and this is when we encourage students to continue exploring what health profession you're interested in, and then possibly start your clinical experience, getting your feet wet in the actual field of healthcare by volunteering in a hospital. Because if you're in a large hospital, you can come into contact with physicians and PAs and physical therapists, occupational therapists, everything that there is in the hospital. Your second year is a time to really kind of understand that setting. You can also go into research in your second year. But we kind of switch, whatever your schedule fits in, we suggest that you start research and or clinical experience. And that's your exploration phase within your first and second year. Now, if you are in your third year, so we already went through everything that you should be doing in your third year if you are interested in becoming a scholar. But you should also be looking into starting research experiences if you haven't already. And like I mentioned, research is how medicine changes. So no matter what healthcare profession you're going into, you should understand the process of those new breakthroughs that are coming through all the time, or just understand the research process in general. With your fourth year, those that are in your fourth year, we're hoping that by then you'd be a scholar and you're involved in research, mentorships, starting campus visits to different graduate school programs, and then really understanding what it means and understanding your whole application. That's really your profile development. So you should be sitting down with one of us as pre-health advisors or some type of mentor, some type of PI, and really talking about everything that you've done and getting your profile analyzed for its competitiveness. So that's where we suggest that students are doing that. And you're in the preparation phase. So first and second year is really the exploring, understanding everything that's out there, understanding yourself as it relates to healthcare. And then your third, fourth, and on, you're really preparing. So really understanding what you need to do to make sure that your application is solid. And then in your gap or growth year, that's a prime fellow year. So those of you who are interested in prime fellows, you're also doing research and you're mentoring and getting mentored along with test prep, campus visits, and still developing that graduate school application. And that's also the time to apply to your graduate school program. Is there any questions? Yes.
Because you guys want a total of 20 scholars within the program, are you thinking of doing 5 first years, 5 second years, 5 third years, 5 fourth years?
That's a great question. So what we are looking for is this program is geared towards juniors. So we want juniors to apply that are going into their senior year, and then maybe some sophomores going into their junior year. But that's the main, as far as the cohort experience, that's where we want students to be. That's where we want students to be at. Does that make sense? Yes.
So for the gap year, do you want us to have a gap year, or what if we can't afford a gap year?
Okay, so that is a very good question, and it's a one-on-one. So we have to kind of talk about a lot of different things. So a lot of different aspects to it. So I would ask you, what direction do you want to go? What health profession are you interested in? What does your profile look like so far? What have you done? And then you don't want to apply until you are competitive. So your right time to apply is when you're competitive, not necessarily when you think everyone else applies. So I would love to just sit down and kind of talk about what your profile is so that we can determine what would be the best outcome. Yes.
So last summer I was taking summer school, and when I applied for financial aid, it also said they were asking what class I was taking and if I was doing any research.
Okay.
And to put if I was receiving any financial aid on that.
Okay.
Would we also have to do that process for this program for the summer or no?
As far as what part? Putting debt, are you saying do you have to report that to the financial aid?
Yeah, basically.
Okay, so we will get some more details on that, and then when we get closer to students applying, we can kind of give you all the details of exactly how, just to make sure that it doesn't impact in a negative way. Okay, so we'll make sure that happens.
Aside from the eligibility of UC3P, what does a competitive applicant look like for this program?
A competitive applicant for this program or a pre-health applicant?
The prime scholar.
The prime scholar. So a competitive applicant, we're looking for students that are passionate about health equity. We're looking for students that our main goal is to really close the gaps for students that are pursuing healthcare and maybe first generation marginalized student. That's what makes you competitive. So it's not about like who has the best grades or the best research profile or the best. It's really about what is your mission? What are you passionate about? And we want to make sure that you're here for the right reasons. And we are a mission-based program. So we want to close the gaps in healthcare equity. And we want to make sure that students that are at most risk for not reaching those goals, we service those students. Okay? So that's what a competitive applicant would be. Any other questions?
Just to clarify, as a first,
we're
not allowed to apply to UC.
So what we're focused is, so the scholar program and what we have for the scholars are more focused on the upper division students. And so that's why we kind of showed in their first and second year, we will still have activities. We will have open sessions available and resources available. At this time, we don't have our hours set up, but within the next few quarters, we will have hours set up where freshmen and sophomores can come in and get advising, and we will still service all of the students that we are that our program wishes to reach out to. But the actual scholar program will be more focused on those rising, third year students. Okay. Does that make sense to everyone? Okay, so that's the end of, we had all the questions. Do we have any more? Any more questions? You look like you have a question.
I just want to re-clarify.
Yes, go ahead, please.
If I'm a bio major, can I still apply?
Yes,
because I feel
absolutely.
like, I'm a first generation college student.
Yes, okay.
And I just feel like I'm not going to be able to get into med school. I am very discouraged because there's so much competition and even in bio-sci, and I just feel like I am not there like everybody else. So
you are why we have this program.
Okay, yes, so thank you.
We want to take you in and let you know that although those classes, it's very competitive, there is a way for you to get there, and we're here to close the gaps for you. So we are here for you. And we also want to emphasize that students can get to these healthcare professions without being in those very competitive majors. So if you're in biosci, no problem. If you want to continue to go through, but you heard there's a lot of other health professions, a lot of other majors that students are still pursuing healthcare and they're in. So if you enjoy bio, if you're passionate about it, then definitely go for it. But if you're like, there's some other kind of interesting subject matter that I would like to dive into, but I still want to go to medical school, let's talk about kind of other ways that you can look into other majors, but still focus on your prerequisites for your particular healthcare profession.
Yeah, because I'm a transfer student.
Okay.
It's just I never knew you could get into medical school with other majors until I got here to UCI. So now I can't go back, but I mean, that's why I'm minoring, because I only wanted to major in psychology.
Okay,
so that was perfect. But now I know for my daughter, if she ever wants to, you can do pre-med a different route.
Absolutely. So absolutely. And that's our goal, to let you know that you can get to healthcare, you can do pre-med, you can do pre-dent without being biosci. Our biosci, that is okay too. Okay? Excellent. Yes.
So if we're not in a part of the Prime Scholars,
yes,
can we still utilize the resources that you guys have?
Yes. So coming to so as I mentioned, we're a new program, so we're still developing a lot of the components. But one of the components that we are in development with is the advising component, where we are allowing first and second year students that aren't yet scholars to get advising and get help and assistance in overcoming these barriers and perceived barriers. We will work out how we're going to make sure that you guys have access to our services, no matter what year you are, whether you're a scholar or not.
So how would we, let's say I wanted consultation on what I should, extracurriculars and research I should be taking.
Yes.
do I make an appointment or what is that
Yes.
process?
So far, what we have been doing, shoot us an email, and then we have our links for one-on-one appointments. And then we can just set up an appointment and we can kind of talk about where you are and then, what the plan is. So if you're a first year, the conversation is, okay, what does it mean to be a competitive applicant? What should you be doing? As a transfer student, it might be, okay, tell me all about what you've done so far. This is what a competitive applicant looks like. These are some things that you can do to get there. Or maybe you're ready right now, and then these are the things that you need to be doing to set up a competitive application.
Thank you.
No problem. Okay, so with that, if there's no more questions, we're gonna transition into our panel section. We're gonna bring up our scholars, and we also do have a mentor here with us to talk about the experiences that they had so far.
Your name, your year, what major are you, and track that you're currently on.
I'll start. I'm a mentor, so not everything's applicable, but my name is Omataro Balogun. I use she, they pronouns. I graduated from University of Pittsburgh in 2015. So I took like 8 gap years before coming to medical school. So just to let you know that it's possible, I had a whole career in public health. I was doing like HIV outreach, strategic planning, just sort of like grant writing. I was like running programs at the community health center level. And then I don't know, I just kind of was feeling like a deep disconnect about like what I was doing. I was always interested in medicine, but was just kind of taking like the scenic route, I guess. I also worked in fashion and did like product development. So just to say that all pathways are valuable, all backgrounds, any experience you've had definitely adds to your to who you are as a person and what you can bring to the table as like a provider. So yeah, like when people ask me like, what do you think are the jobs that you've had that have like really prepared you for a career in medicine? I always talk about, well, right now I do a lot of nannying and tutoring on the side for like high school students. And I honestly think that has been really valuable, just like the educational aspect. It makes it very easy to like relate to students. And then also like picking up babies, they're like really squishy things. And I think that like a lot of people don't think about like those other like careers that like kind of like help. Like my experience working in restaurants has also been very helpful. So just to say that like no matter what your background is, there's a place for someone like you in this career. And I really want everyone, I'm saying this because it was something that I feel like I didn't hear enough of as an undergraduate. And I really related to a lot about what you said about not really feeling. I personally felt like University of Pittsburgh is a very like great medical school, and so like the undergraduate pipeline to get to that medical school, I think was like kind of a little toxic, and like the pre-med culture I feel like was very like not the opposite of collaborative, whatever that is. And so I'm really glad that we have a program like this here. My major was microbiology, but I also double majored in Spanish, and I did like Latin American studies and global studies as like part of like my curriculum because I really wanted to be a well-rounded student, just like for myself. And I knew that I wanted to work in like marginalized communities and work with underserved communities. So for me, it was important to like, in Spanish, and I ended up like studying abroad in DR, and that is what made me want to move to New York after I graduated college, and that's where I lived for like during my 8 gap years. So yeah, that's about me.
She's a very interesting person. My name is Shada. I'm once again, 3rd-year exercise science major. I'm a part of the primary care and delivery pathway. My PI is Dr. Candace Taylor Lucas. I joined UC3P because it sounded like a really great opportunity. I'm very much into minority outreach and making sure that the community is heard. I'm a first-gen low-income student, so I didn't really have a lot of resources growing up. No one really went to college around me. So yeah, I joined this so I can kind of get more clinical experience, clinical research, dip my feet in because I was like, wow, it's my second year, time is ticking. I need to do something. So I really don't think I made a mistake by joining UC3. I think this was like one of the biggest blessings in my opinion.
So my name is Stephanie. I'm a second year nursing major, and I'm on the primary care track. My PI is Dr. Bounds. Yeah, I joined UC3P for like the similar reasons. I was looking for a little bit more like clinical experience, also like a lot of advising. I was already in a research lab when I applied for the program, but yeah, I have really valued my experience so far. I have learned a lot of things, even though like my track is to become like a psychiatric nurse. I do think that a lot of like the workshops that we have had that we've attended so far as scholars has really like helped me just think about like the entire aspect of healthcare, not just like like what you like typically think of as healthcare. So yeah.
My name is Gabriel. I am a third year public health sciences major, and I am on the biomedical and translational research track. And my PI is Dr. Chuli Uyoa. I think I originally joined UC3P because just like them, I wanted like clinical experience and I wanted kind of guidance related to like pursuing a pre-health pathway and health career. But it was also the research portion of the program that kind of got me even more interested because I wanted to take part in a program that was structured and that gave me an opportunity to conduct research.
Thank you for that. And that leads us to our next question for scholars. Could you share a little bit about your research topic and also touch on how UC3P has helped you in that regard?
Okay, so I am not in a lab setting. Mine's more, I guess, clinical research side than like the typical wet lab that you see with like raw mice and all that stuff. It's not that. I'm also completely starting my research topic from scratch. Mine's on fostering belonging within Black athletes in UCI athletics. So I'm working alongside an inaugural program, the Black Student Athlete Alliance. It's the first Black Student Athlete Alliance that we've ever had at UCI. So yeah, I'm working alongside them to figure out how we can better foster belonging for Black athletes on UCI because I feel like they're really overshadowed and overlooked within UCI in general. Athletes in general are very much like to see a different, like what let me preface this. I'm an intern for UCI Athletics, so I work in the training room alongside athletic trainers. And getting to know these athletes one-on-one, you really get to see a different side of them that you don't really see, like with social media. Like you'll see these posts, like you recently saw UCI men's basketball beating USC. Exactly. And like that's all cool. That's the base, but like getting to know them and like understanding where they come from and like their sense of belonging as a UCI student is completely different than what we usually are assuming or seeing. So yeah, my job is just basically to understand that, figure out the different methods to try to kind of bridge those gaps and foster more belonging.
So for me, my research topic is my primary like area of interest is eating disorders. So I'm like for my research topic, I'm like touching on that a little bit. So like under my lab, we do a lot of health coaching with adolescents that have ACEs, so adverse childhood experiences. So my research topic is focused on disordered eating habits amongst like minority communities and kids who have a history of ACEs, just because minorities and like people of color tend to have a higher risk and have higher rates of experiencing eating disorders, contrary to popular belief. So yeah, that's what my research is about.
So I'm a little bit different from them. I am in a wet lab. So my research is a bit, so it's just like wet lab research. Basically, the lab has a general focus of developing treatments for refractory cases of infection, which is just basically infections that are very difficult to treat for whatever reason. And more specifically, we're focusing right now on a bacteria called MSSA. You might know them as staph infections. Like people usually get them on their skin or all around their body. But when they start to infect whole systems like the heart or the blood or the lungs, they become very, very difficult to treat. So basically what I'm doing right now is I'm trying to understand why one treatment is working very well in clinical cases. It's an unconventional treatment because it uses an antibiotic that is not really used to treat this kind of infection. But we have basically evidence published by my PI and by others that the treatment works very well. So I'm analyzing cytokines from blood after administering the treatment to see why the treatment is working. But yeah, so our overarching goal is just expanding treatments for bacterial infections.
I wanted to add that I completely missed the second half of the question on how UC3P definitely helped us to figure out our research topic or how they've helped to further our research. And I was not involved in any kind of research before this program. I barely had any kind of clinical experience. I only had the internship that I came in with. Like telling you full first gen experience, I did not know what anything was. I didn't know what working in a hospital was or volunteering or anything. So I think C3P kind of helped give me the staff that I would need to start a research project from scratch. And I don't think I would have obviously been able to do it if I didn't have the connections and the resources of a PI, like a doctor or somebody who has the connection to hospitals or connection to med students or connection to athletics. Like I think UC3P just helped me to be able to even put my foot in the water and be like, okay, I actually want to do research and I want to start this project that no one's really done before.
Thank you all. That was a great segue into the next question. Yeah.
Sorry, so I did want to kind of add because I also missed the second part. But I think one way that UC3P has helped me in my research is talking about it. Because a very difficult thing for me, at least in this area of research, is trying to make the research understandable to people or to make it very interesting. So yeah, one thing we did over the summer was focus on how to talk about your research in a way that's not over the top or too confusing. So yeah, UC3P definitely helped a little with that.
Can we give it up for how well they just talked about the research?
Thank you all. So the next question's kind of similar is, what do you know now that you didn't know prior to joining UC3P? So this could be a piece of advice, knowledge, insight, skill, however you'd like to interpret that.
I think knowing that you're not alone, because I know there's also just an overwhelming amount of resources that UCI has, whether that means they're catered to exactly everything that you want or they're not. I think UC3P has helped me to kind of narrow down, okay, where do my morals lie? Where do my interests lie? What programs would fit me, which won't? And I think I really realize I really love equity outreach, community outreach, and I think understanding what pathway I want to go down when it comes to whichever career pathway I choose, UC3P has helped me to kind of center down into, because it's an overwhelming amount of information that sometimes just gets thrown at you your first year that you're not really ready for or used to. So, yeah.
For me, I would say just learning how to facilitate the resources and how to utilize them as well. And then just in terms of knowledge, prior to joining UC3P, I did not know what for example what an elevator pitch is, how to pitch your research, how to figure out what you are interested in, that research doesn't have to be something that's how to make research something that you're interested in. I'm not sure if that makes sense. But yeah, a lot of the workshops that we had over the summer for me were really, really helpful. I learned a lot. So
one thing I know now is to focus in on why you're pursuing your specific career path. Prior to joining the program, I kind of had an idea that I wanted to pursue medicine and maybe research. But it wasn't until like really thinking about it, like why is it that you want to do this, that I started to realize like, I should really be sure that I want to do this, because if I'm not like entirely sure, I can end up in like a graduate program or doing something that I absolutely hate. So luckily, I am starting to figure that out. Like, why is it that I want to do research? But it's or research and medicine, but it wasn't like something that I had really sat down and considered until I was prompted to by graduate students in a panel that we had over the summer.
Can I add something? I think something that I learned is that like, again, once again, there's no like wrong path. They're just like longer paths, right? Like, I probably could have applied to medical school, honestly, like as soon as I graduated. But when I graduated, I like moved back home to Chicago, and I was like studying for the MCAT, and I just didn't feel, for me, it really was a lot about the environment. Like I was just like, ugh, like don't want to go to medical school because like I really hated everyone who was pre-med and like not trying to be in school with these people, you know what I mean? And so I was like, I'm not doing it. And then I moved to New York and explored so many other different interests, and then found my way kind of like back to medicine. But once again, like, and for a lot of those years, I felt a lot of like shame and just like disappointment. Like all my friends who we all graduated at the same time, they're all like in residency, finishing residency right now, and I'm like second year med student. You know what I mean? Like, and so, but like then when I think about like their lives and I think about my life, and then I do sort of like, okay, like what experiences did I have during my growth years? What experiences did they have during medical school? Like in the end, it kind of like all balances out is basically what I'm trying to like say. There's no like rush. Everything is an arbitrary timeline. Like honestly, like just take your time, go at your own pace. And I like what you said in terms of like how the program kind of allowed you to take an inventory of like what your interests are, just to make sure that you don't like waste your time, but also kind of wanting to say like there is no such thing as wasted time. Like there's time spent doing something maybe you didn't like as much, but then guess what? You learned that you didn't like that as much, and you'll never do it again, maybe. Or maybe you'll do it and you'll have the skills to do it faster or whatever. Like there's so many parts of my old job that I used to hate, that now that I'm a medical student and I'm involved in so many different, I have like 5 different labs that I'm part of. And like the number of times people are like, oh, can you write this grant? Oh, can you analyze this data? Oh, can you do this? And like, I realized like, oh, these are not even things, like I also have a master's from GW that I kind of got during those 8 years, my 8 gap years. But like I have so many skills that are like very niche that I didn't even learn like in grad school. Like these are just things that you pick up on the job. So all of this to say, once again, there's no such thing as like a wasted or like valueless experience. Everything that you go through has value, even if it's just to tell you that this sucks and you never want to do it again or whatever.
Thank you. Okay, so this question is for all of you. Who would you recommend join UC3P? You can start from either side.
So it was just discussed with I think if you're somebody who's interested in pursuing medicine, or just any of like the health careers or health related research, but you're kind of like stuck not understanding what the process is, or if you're discouraged or demoralized from pursuing the career for whatever reason. Like I know it can be very difficult being in a lot of these pre-med circles or pre-med environments, because everybody takes it like there's only one right way to do something, or if you're not doing it this way, you're doing it wrong. So if you are like kind of in that position that you don't really know how to go about the process, but you are interested in it, in going into these kinds of careers, then I would say you're probably the right person for this program.
Just to expand a little bit more, I also think that if you're maybe feeling like you're in a place where you feel like a little bit stuck, I know this is something that I experienced last year, just like being like in the middle of all of the classes, like it's just kind of like thinking like, why am I doing this? Like I needed something to give me sort of like that purpose and that drive to like want to continue. And I think that if you're maybe in that place right now, this is definitely a good way for you to just sort of like reinvigorate that sort of like want, that sort of passion again. Just like again, like through your research, because your research, you get to choose what you want to do research on. So you can literally do it on whatever you want. And then also like just with a lot of like just the resources that the program does provide, if you're like if you're looking for like a volunteer, like you want to like volunteer somewhere, you can contact the program coordinators and be like, hey, this is what I am looking for, like can you help me with this to like find this. So I think if you're in those sort of like places right now, this is definitely a really good program for that.
Yeah, they both made really great points. I think I resonate heavily with what Stephanie was saying about feeling stuck, I guess, in a way, because that imposter syndrome is real. And it's definitely real when you're like me, a bio major, school of bio major, on that pre-med track, seeing everyone get certain A's or certain like grades, and you're here doing something different in a different track and everything like that. So I definitely understand it can be a little discouraging, but like a program like UC3P is a kind of a community for you, a group of people who are trained to help you pursue your pathway that you choose to go through. I think UC3P is meant for those who are really obviously marginalized. A lot of people here have experienced marginalization and not being represented in healthcare or in their lives in general. So I think CPP is just for those really who need the push, who need the drive, who need the motivation to just keep going and keep pursuing the healthcare or the pathway that you choose.
Yeah, I feel like they really covered kind of like everything, but I just really want to emphasize that like there's this huge idea of the hidden curriculum, like, and of how, and this hidden curriculum is like basically like the steps to get to medical school are just kind of some sort of like, you know, like secret path, like to get from point A to point B. And a lot of people navigate that very easily. They're just kind of skipping down the path. And some people are like, I literally don't even know the direction that I'm supposed to go to. If you're someone who feels like you don't even know a first step, I would consider this a great program. Like for me, like someone, I mean, like, I consider myself honestly someone who like was like I always knew I was like interested in medicine. So I had been someone who like my parents like from very young pushed me to like enter pipeline programs. And so like, you know, in high school I was doing research, and when I went to college I was doing research and all of these things. But even still for me, I still felt like there was a hidden curriculum, and because I was so anti like all the pre-meds, I just like didn't engage in any of the information. And so then when it was like time for me to take the MCAT, I was like, oh dang, I gotta go do that? How do I do that? And like I felt like I had to just kind of like personally invest a lot of time trying to advocate for myself. And this is a program here kind of like already laying the work out for you with people who are awesome, don't suck, and have like a lot of resources kind of just like already pulled together. And so like once again, like if you're someone who's just like feeling really lost, and even if you're someone who like kind of like knows where they're going, this is just a place for people who like don't feel like they have a home in terms of like support for like this journey. And I think that that's the value of this program.
Thank you all. So now we're going to open it up for Q&A, but before we do so, please join me in giving them a round of applause. Do we have any questions for our panelists? Yeah.
I'm interested in joining research, but I've heard of like clinical research and like wet lab, and I don't know which one I should join or like what will be the biggest difference. So like, what exactly do you do on like each of them? Because I want to see which one I will be more comfortable or capable of doing.
You said you wanted to join a wet lab?
Wet lab or clinical research.
Yeah, was here like a day in the life of that kind
Yeah,
of
basically.
So for me, it's Yeah, pretty much all wet, like doing like assays and stuff like that. So you're doing a lot of work with, I mean, it's minimal math, but you're doing some math and then like you're working with pipettes a lot. Eventually you might work on mice and stuff like that. So it's a lot of time in the lab, but you also have some time like outside of the lab where you're reading papers and stuff like that. But I'd say a majority of the work you're doing it like on a bench, literally with like pipettes and whatever stuff like that.
So for me, mine is not a web lab at all. I was not interested in any of that kind of aspect. So for me, I love my lab. I love my PI. She is amazing. It's not like super high commitment. It's like you put in what you want to get out, if that makes sense. So if you want to spend like 8 hours a week on the lab, then you can do that. There's also like in my lab there, so what we do, I mentioned it a little bit earlier. So the primary focus of it is just providing like health coaching. It's like an 8-week health coaching sessions once a week over Zoom to adolescents that have a history of ACEs, so adverse childhood experiences. And then you can be like a health coach, which is like you're interacting with like the youth and also the caregiver directly. You can also do a lot of stuff in the background, so like doing like intake, doing assessments, doing follow-ups. I'm trying to think what else. Or you can also like look like you can be what's it called? It starts with an F. Fidelity checker. So where you're like going over, you're looking at the health coaching sessions and making sure like they're like following what the like agenda is for that particular session. So I sort of dipped my toe into everything. I personally enjoy health coaching the most just because I get to like interact with families more. So that's basically like what I do.
My research is still under construction as I'm still going through approval processes. But a little bit about what my internship does. I just work with athletes and like I work with the athletic trainers and it kind of would go alongside my research as well because a part of what I'm going to be testing is our injuries and like sitting out from games and practices and like a lot of athletes, they deal with ACL tears and they're out and it's like now they don't have what they're coming to school here for. Like now their identity, their belonging is kind of jumbled up a bit. There's like, it's like, oh, am I still an athlete? I'm not in the game. I'm not playing. I'm not practicing. I'm not really with my team. So what I do is I'm working with the athletes. I'm talking to them one-on-one. I'm communicating with them. And it's completely different than a wet lab setting where you're basically kind of on your own or talking to your PI or talking to your grad student that's assigned to you or things like that. It's definitely, I think choosing, I knew after Gen Chem labs, after OChem labs, I was just like, man, I don't like this wet lab setting. I don't like being in a lab, respectfully. 4 or 5, I'm okay. I liked the one-on-one communication, talking to people, talking to patients, talking to higher ups. I liked communicating and talking, getting to know people. So I think the clinical research setting was more my fit versus the wet lab setting.
So there's like in general, I would say like not even 2 types of research. I would say there's actually like 3 kind of. I mean like there's like the basic sciences and translational, right? And that's like what you're doing, right? Like translational as in like you're working with like animal models and then you're translating like the applications of like, oh, does this treatment work, whatever. That knowledge is being translated and applied to like, can you use this in humans? And then there's like clinical research, which can be broken down into like so many different little subsets, but like kind of like what you have been doing, Stephanie, like seems to fit more like the social behavioral type of research where you're like doing an intervention and you're like kind of it seems like you're in the implementation phase. Yeah. So like you're implementing it, you're collecting data by doing like interviews or, like, intervention, maybe doing a survey, that kind of thing. And then there's also like retrospective clinical research, which is what a lot of my research focuses on. And that's like going into like electronic medical records, so like looking at clinical data and then kind of like asking research questions and analyzing that data to answer those questions. So like I'm in a lab right now that like is focusing on understanding like heart cardiovascular disease for patients with high risk pregnancies, and just kind of like trying to like this is like through UCI Health, so trying to figure out like steps in the care delivery model where like we can kind of intervene to basically close those gaps and eliminate health disparities. But we identify those gaps by being like, okay, so like a patient who like came for a visit and like presented with cardiovascular disease or whatever and is pregnant, like what were their outcomes at this visit during the prenatal phase? What were their outcomes at this visit? And so like we're looking at that, yeah. And then that kind of like is very similar to like QI or like quality improvement, which often uses this thing called PDSA cycles or like plan, do, study, act. So basically like that's where you're like already in a setting, you like notice a problem, like for example, you're like the number of pregnant patients that come back for their 24-week like sonogram is like very low. Why is that number? So we're asking a question and then we're gonna say like, okay, we'll come up with like a little pilot study and we'll make sure to like send out like text messages or something to mothers like in the 22nd week or something. And then we'll come back and like a couple months later and we'll see like, okay, did doing the text message thing for like this number of weeks, like did that work? And then based off of that, then we'll like study it and see like, okay, did it work? Did it not work? And then can we implement this or how can we like change that? So basically saying like there's obviously so many different ways you can get involved, right? Like if you don't like to sit at the bench, and I did wet lab research for 3 years during undergrad and have not stepped in a lab since. So all of this to say like, for me, I realized like I liked talking to people more and like being more interactive. And then honestly, like the easiest research I would say is like any retrospective study, clinical study where you're like going back into the patient charts. And I mean, I know there's like a lot of great PIs here that do research, I think at like everything from like the retrospective, so looking back, to prospective, as in like creating your own studies and doing that. But from my personal experience, retrospective is like the easiest to get involved in at UCI, has like the shortest like research IRB proposal, like timeline. So that's an opportunity. But that not to take away from the fact that if you like want to come up with a project from scratch, like I'm right now like in the process of coming up with a project to understand how do we improve gender affirming care within the OB/GYN clinical setting. Like that's something that has never been studied here before. And so like uphill battle, but we're fighting it.
Thank you.
And we're gonna take one more question and have one or two of our panelists answer that question.
Oh, in the back.
How are the commitments like during the school year, and how are you able to manage that with the school load?
One or two of our panelists just answer that.
I love this question because I load up my plate so much. I love to just keep adding. I think it's UC3P, in my opinion, is one of the more to commit to. Like this is the one that I want to come to. I want to learn more about my future. This is something I prioritize on top of my school, like the list of commitments, school, UC3P. It's something for me that like it's helping me stay focused. Like, why am I still in school? Why am I still working towards this? Why do I want to be a doctor? Why am I pre-med? Like this is something I think is a pretty easy one for me to manage, because I'm like, this aligns with my goals, my future. This aligns with school. This is basically as important to me as school. So I think it's a pretty low commitment as well. We have bi-weekly meetings. So I mean, it's not hard to show up, not gonna lie. And there's food.
So if you didn't get food,
Please get food. It's good.
Okay, well, for the sake of time, I think we will wrap up there. I want to say a special thank you, Omotayo, for going over that research information, because I feel like everyone was enlightened with that outline of the different routes, because that's a common misconception that bench research is the only option. So thank you so much for going over that, and thank you to all the panelists for sharing your experience and helping everyone understand what you guys are into and what your goals are and what your mission are and what this mission-focused program is about. So as we end, I hope that all of you guys can please scan this QR code, because that's our evaluation. As I mentioned, we are a new program establishing, so we want to know how we're doing, what was valuable about this presentation. So give us your feedback and let us know if we should do more of these. And we hope to see all of you at future events. Those of you who are second and third, we hope to see your applications coming up in January. And you have our email addresses. So if any of you do have questions or want to meet with us, definitely shoot us an email. We are here to help you, and we are here to see you all succeed. So thank you so much all for being here.
Your name, your year, what major are you, and track that you're currently on.
I'll start. I'm a mentor, so not everything's applicable, but my name is Omotayo Balogun. I use she, they pronouns. I graduated from University of Pittsburgh in 2015. So I took like 8 gap years before coming to medical school. So just to let you know that it's possible, I had a whole career like in public health. I was doing like HIV outreach, strategic planning, which is sort of like grant writing. I was like running programs at the community health center level. And then, I don't know, I just kind of was feeling like a deep disconnect about like what I was doing. I was always interested in medicine, but was just kind of taking like the scenic route, I guess. I also worked in fashion and did like product development. So just to say that all pathways are valuable, all backgrounds, any experience you've had definitely adds to your to who you are as a person and what you can bring to the table as like a provider. So yeah, like when people ask me like, what do you think are the jobs that you've had that have like really prepared you for a career in medicine? I always talk about